Hello, everyone. This is the PTTC NCO with our webinar. I'll be putting up a poll that if you all can answer as you come in, just to get us started, we would appreciate that. And if you'd like, you can also open the chat, introduce yourselves, say hi, and we'll be beginning in just a few minutes. All right, well, thank you all who participated in our poll. Here are the results that'll kick us off. So we can see that most people noted that there were multiple data processes related to prevention ethics, which we'll get further into with our webinar. All right. So this is the Prevention Technology Transfer Center Network, NCO, Advanced Ethics Planning Series. This is our third session, building on previous two sessions that happened in 2021. This webinar is now live. We'll be recording it and posting it to our website within the next 2 weeks. So if you'd like to review, you have to leave early, you'd like to share it with a coworker, that will be available. This training was developed under the Substance Abuse and Mental Health Service Administration's Prevention Technology Transfer Center Task Order, reference 1H79SP081018, with training use only. Our chat and Q&A feature is open throughout the session. Please feel free to type in whenever you get to it. We will have a designated Q&A time in this webinar, and at that point we'll be addressing those questions live. Chatting in the Zoom webinar. If you're not familiar with this feature, when you go to your chat bar, make sure, depending on where you want it to go, you can go to the panelists. You can have it come to me. I am the host and the staff member from the NCO who is hosting this webinar. You can send it to the panelists and attendees. Again, if you have any trouble, please let me know. That's it for housekeeping, and I'll pass it over to our another one of our members of the Building Health Equity and Social Justice work group, the work group putting on this webinar, Deborah Nixon Hughes.
Hello. As Catherine said, my name is Deborah Nixon Hughes, and I'm the project director for one of the PTTCs that are sponsoring this particular webinar. One of the founding principles that we use in all of our training and technical assistance is affirming that language inspires hope. Language matters. We realize that words have power, so we attempt to use people first language in all that we do. Next slide. So as part of the PTTCs, what you have on your screen are the purpose of the training and technical assistance centers. And so we look to improve implementation and delivery of effective substance use prevention interventions. We also provide training and technical assistance services to the substance use prevention field. And so we do it by tailoring what the needs are to the recipients and to the prevention field. We base our training and technical assistance in prevention science and use evidence-based and promising practices. And we leverage our expertise and resources available through the alliances formed within and across the HHS regions and the PTTC network. Next slide. So we, as you've heard me talk about, are part of a network. There are 10 prevention technology transfer centers across the country. And that's what this map is attempting to reflect. I know it's kind of small. We have 2 national centers, the Hispanic and Latino Center, as well as the American Indian Native Alaskan Center. And it's all under the umbrella of what we call the National Coordinating Center, which is the NCO, which is located in Kansas City. Next slide. So across the network, we have 6 major focus areas, and those focus areas are based on what we heard that people are most interested in. But the 2 that are sponsoring this particular webinar is the Building Health Equity and Social Justice, as well as the Implementation Science work groups. Next slide. So I'm not going to read all that, but this is the Building Health Equity and Social Justice work group. And these are the different regions that are represented in that particular work group, as well as we have SAMHSA as part of this. And we also have the African American Center of Excellence that doesn't seem to be on here. But anyway, that's the other one. And then next slide. We want to thank the committee that worked on this, and here are the names of the people that worked on this whole series, which I think is very much needed and very well done thus far. So we're looking forward to today. Next slide. And then again, we collaborated with the Implementation Science work group, and here are some of the people. I'm not sure that it's all of the people that are involved in that particular work group. Next slide. And without any further ado, here's the meat and the potatoes of the webinar today. I'd like to introduce you to Nicole S., and she's with the Southwest Prevention Technology Center. She's been assisting in prevention and HIV public health programs with collecting, analyzing, and communicating data over 20 years. She is an evaluator. So looking forward to Nicole, and I am going to turn it over to you.
Thank you, Deborah. Well, I'm so glad to be with you all here today and learn together. Let me go ahead and pull up my slides, and you all can tell me if I got to them okay. All right. Can you all see that okay?
Yes.
All right. So I just wanted to talk a little bit about our roadmap today. And this is really exciting for me to be here because this is a topic really near and dear to my heart. So welcome everyone, and we're going to have an incredible data journey, as I like to say, data equity and justice journey today. So we're going to start out with defining data equity and justice, and then we'll talk about how ethics and professional behavior and those data related prevention activities that we all are involved with, right, relate to each other. And then talk about some tips for ensuring equity and justice with data and what those are. We also will do a lot of dialogue around examples with data ethics scenarios, and you guys are going to have an opportunity to provide a lot of input from the field and the work that you do and how this impacts this topic. Finally, we'll be presenting some resources for data equity and justice as we move through the day. And then at the very end, we'll provide you with a list of those. So welcome. I'm so glad to be here. And as Deborah mentioned, I've been doing this work for a long time, which probably shows my age, but I have been at this for about 20 years. I started out in more of an academic sense, and this kind of just points to how important this topic is. But I started out in quantitative psychology, and my first job out of that degree that pertained to my degree and not working in restaurants was working at the state health department. And my first day on the job, I got called into a meeting, and I was surrounded by a bunch of data partners and community members. And we were designing a survey, and me thinking I had it all figured out, I offered that they probably needed to do these long quantitative Likert scales after each question because my background was in experimental psychology. And I quickly got reminded that I've forgotten about the context. I had forgotten that this would be going out to people that were incarcerated, and that, you know, I needed to sit back and listen a little bit. And so, you know, that's just a lesson in, you know, sometimes we come to the table and we think we have it all figured out. And sometimes as researchers or evaluators, we come to the table and we think we have it all figured out. But the important thing is we need to sit back and listen, and we need to take context into account in the work that we do. And so the same goes for us as prevention professionals. I've since become a certified prevention specialist. Prevention is near and dear to my heart, as well as HIV prevention and HIV treatment. And so in all these areas, these are complex social issues that we're here to discuss, assess, evaluate. And when you have complex social issues, you do have to sit back and listen. And it doesn't matter what your academic background is. So I just wanted to share that little story to get us started, because it kind of humbles all of us. And that's really where we need to come to the table, is with that being humble, having cultural humility, and really sitting back and listening to our partners. So a good place for us to start is, of course, the SPIF. And how many of you, just a quick little yes in the chat if you're familiar with this. I'm sure you are, but if you're not, all right, we're getting some yeses, great. Seeing mostly yeses. I kind of figured that, but it's always good to kind of go back and anchor ourselves into the work that we do as prevention professionals. And so with the SPIF, we are really looking at the steps, but we also need to remember that these are iterative, right? We may start out in assessment and may move into capacity with doing some training, but then may realize we've got to go back and do some more assessment. And so just remember that this isn't really a sequential process all the time, and that we also are guided by our principles with sustainability and cultural competence in the center. And this definitely points to our topic today with data equity and justice, because if we do not utilize those principles, we're not going to be sustainable, and we're not going to be culturally competent in any of these steps. So to start off, we want to hear a little bit from you. So what areas of the SPIF do you feel data plays a role? And you can just casually submit your answer in the chat. We'll just keep an eye on it there. Okay, we've got some, all of them. Assessment, all. Lots of alls. See some, all, but heavily in assessment and evaluation. All right, well, you guys are doing awesome. You are correct, all of you. There's really no right or wrong answer here because it is all of them. So we do see definitely more of an emphasis on data in assessment and evaluation, but we sometimes forget that during that strategic planning phase, we're taking all that data and we're looking at it and making those plans to select strategies. And so we really are using data throughout this process. In fact, we need to be using data throughout this process, right? We don't just wait till the very end at evaluation. So when we start off with assessment, which is our focus today, but I just wanted to make that point that we do use data throughout the entire life cycle of the SPIF. All right, so how have you used the SPIF in your work around data and equity? Are there some ways that you have used the SPIF in your work, specifically with data and equity? And I see some comments about data as the foundation of the program. Good. Any ways that you have used it in your work? Making sure all are represented. Good. Numbers don't lie. Data always points us in the direction. Finding out new areas in which to focus, identifying the underserved, looking for and using data that is representative of the population I am working for. Good. Using a racial equity lens when reviewing the data. Great. Learning where to focus, knowing which direction. Awesome. You guys are offering a lot of good ideas here. Assisting with policy making, and we will talk a little bit about that. Data with stories. It's used to help tell a story and prove the need for a particular service or program, and that points to our advocacy, which we'll also be talking about today. Okay, great. Well, in the respect of time, we'll move on to our next question, but I appreciate all the great responses we're getting. So what are the benefits that you all are seeing after using the data in the SPIF around equity and justice? Data shows real versus perception. And we'll talk about later how even though the data are facts, how it really is important that we involve our stakeholders at every step of the process, because how we interpret that data and how we collect it really can make a different lens in how that data is presented to groups. So it guides planning, good. Getting buy-in, real life stats, exploration of root causes, very good. Evaluate the success of interventions, helps to create a more complete picture in the area we are evaluating. And we'll talk about that a little bit more too, how to really make that picture a well-rounded picture, right? We don't want to just collect data with one method. Real life provides a way to measure outcomes over the long term, and it highlights our gaps in service. Wow, well, I think you guys have already done the presentation for me today. So I appreciate all the great answers and support in participation. I know it's hard when I think we have over 100 people here today. So just be aware, I will involve you as much as I can, but sometimes we will have to keep moving and move through the content, but I appreciate all the participation. Keep it coming. All right. So how does data relate to prevention ethics? and I think we probably all have some ideas about this, right? But it's nice to kind of go back to what our documents, what our foundation says. And so partly how we do that is going back to our prevention ethics through the ICNRC and seeing what we can pull out of there that points to our topic today. So some of the things that I found in doing some research were around presenting data publicly in ways that protect participants. So we have an obligation to make sure that we protect our participants when we're presenting data. There are ways that we can advocate for issues and present data that still protect the confidentiality of our participants. Advocating on behalf of the public and the individual's right to services. So again, advocacy. As a prevention specialist, we have an obligation to advocate on behalf of groups that may be underserved or where there are gaps in services. And so we can use the data to point out those issues and work with our policymakers to advocate on behalf of our clients. Educating the public and policymakers around prevention issues that need attention. We kind of just talked about that. But another aspect of advocacy is also education. So we need to find ways that we can talk to people and engage in dialogue that helps us move things in the right direction in terms of policy. Gathering input from our service recipients, super crucial. So, and I recommend this doesn't happen at the end. So as you are going through and doing your spiff, this needs to be happening throughout the process. So making sure we're monitoring throughout the process and not just at the end with outcome evaluation. This could be as simple as after each service, you're doing a check-in. So it doesn't have to be complicated, but we need to make sure that we are gathering input from our service recipients along the way. Ensuring that data collected is secured. So do we have adequate measures in place to protect confidentiality? Are we de-identifying data? Are we storing it in a proper place? Do we have proper security measures, both physical and online, to protect participants? Collecting information that is necessary and relevant. This is a big one. We want to make sure we collect the information that's needed. So are we drilling down enough to collect the information that's going to be most useful? But it still needs to be necessary and relevant. So I've even had administrators that have a certain agenda working in public health for a long time and ask for certain things around data that were totally not necessary or relevant to what we were doing. And you as the prevention specialist, you as the data owner, you as the researcher or evaluator, you have an obligation to make sure you're asking the right questions when people ask you for data and that you're protecting that information. So there have been times where I've had to say, I don't think that's necessary. I don't think that's relevant to the purpose of your study. Why do you need that information? Make sure you are advocating for the participants who may not have a voice if you are the data owner or the data collector. All right, so that's kind of how our ethics relate to both prevention and data. So there is a lot of overlap, but I just wanted to pull those out so you could kind of see how they connect. So let's hear from you now. We're going to get into talking about data equity and data justice specifically. So how would you define data equity? How would you define data equity? And we'll open up the chat here. How would you define data equity? So accuracy of data that represents all representative of the population served, equal and proportionate representation, all sectors, Great. So really making sure we have all the people involved who need to be involved, representative of the entire population, data that doesn't just lump everyone together, but breaks things down. Correct. Be honest when it's reported and used. Yes, transparency is crucial. Without bias, and bias from the start, including how data is collected. Making sure your data collected was culturally appropriate. Oversampling to understand more about underrepresented groups. Good. Also needs to include qualitative data to provide context for the numbers. Yes, and we will talk a little bit more about that later. Very good. All right, so let's move on to asking about data justice now. How would you define data justice? And they are similar, so you may have some similar responses, but providing data that serve all. Good. I'll give you a minute here. I know these are deep questions to start out with. Community driven and community centered. Yes. Ensuring all populations and communities have the ability to collect and analyze their own data. And we'll get into a framework here in a little bit, Colleen, where we walk through the different levels of community engagement and how that can impact the data. Good. All right. Well, you guys, again, have done an awesome job of answering those tough questions. Oh, I see a couple more. Data that takes into account the systemic impacts of equity. Very good. Yes. The data in action to positively serve the community. I love that word action, right? So action is a big part of data justice. Okay. Well, let's go ahead and move on to our next slide. And we'll just, you guys have already hit on a lot of these, but data equity is the consideration of the ways in which data is collected, analyzed, interpreted, and distributed through an equity lens. So much like our picture here with our magnifying glass, we are going to dig a little deeper, both at the collection, the analysis, the interpretation, and how we distribute that data. And this is a really important thing to think about because the way we collect data really can impact the rest of these, right? If we don't collect it right, then it can impact the rest of these. So let's move on and talk about data justice now. And again, you all tied into a lot of these already, but it's tied to the ethics of data privacy and decision making. And then it does address concerns regarding power and privilege. And so this is why that context and knowing that qualitative data is going to become really important, because we need to understand what the power struggles and privilege are that exist in the community with our participants while we are collecting data, before we are collecting data, while we are analyzing it, all of that. So you all have done awesome in addressing those and looking at root causes and some of the other comments mentioned. So I think, though, overall data justice, we can use that interchangeably in close relation to data equity. But it is also tied to the ethics of personal data and privacy use, which we talked about a little bit already. Big data, some of you have heard that term, and decision making that results from the datafication of modern society. So I think as data grows, as we get into big data, sometimes we're just swimming in data. It becomes even more important for us to protect data privacy and be able to use that data effectively for decision making. So have any of you, or how have you seen data used in a harmful way? And you can use the chat to provide some input, at least from your perspective or in your experience. How have you seen data used in a harmful way to maintain power and privilege? That's another tough question. Limited context. Redlining, only focusing on the negative. Used to make decisions that benefit only a specific group of people. People are just seen as numbers, erasing the subpopulations. Yep. Police data that provides no context. Yep. Causing lack of access. Providing numbers without explanation, made up studies, not collecting enough data from certain groups, skewing information, creating questions and research projects that focus on hypotheses. Inappropriate data use that categorize minorities improperly. Ivory tower institutions where data is collected from a vulnerable community and the community never hears from the researchers again. Yeah. Saying that a population has responded to the program successfully, but not listing numbers and specific descriptors of the population. Using data without appropriate permissions. These are awesome. So we've all had these experiences, right? And LaShonda says people are born American Indian, Alaska Native, and die white. Using old data to prove a point that has been updated and disproven. Yeah. So many misuses and improper ways that can harm populations. And so this definitely points back to our ethics, right? We do have a huge obligation and responsibility to make sure that we are collecting data, analyzing it, talking about it in ethical ways. Skewing data for personal agenda. Yep. Wow. Okay, well, this is why we are here today, right? It's a big topic.
Nicole,
Yeah. Deasia?
before you continue, we did have someone raise their hand in the chat. Alexandria,
sure.
if you would like to pose your question, you may do so now.
Feel free to unmute yourself.
I'm so sorry. That was a complete accident.
Oh,
Sorry. I'm trying to do too many
okay.
things at once. So sorry for the
That is
interruption.
okay. Thank you for unmuting. Let us know. Thank you. All right. Were there any other questions, Deasia? Just making sure before I move on.
There was one more, but I think they removed it. I can't remember the exact name.
Okay. And we also, I'm very fluid when I present, so we can keep going. And if a question comes up, please let us know. We will try to get to it. Thank you all. Okay, so let's see, we are now going to talk about what about prevention. So with all of this going on and our data being used in harmful ways sometimes, what about prevention? How are you bringing data equity to your prevention work? And you can post some of these in the chat. How are you bringing data equity to your prevention work? What are some strategies? We always like to talk about things that we can actually do in prevention, right? What are some strategies? How are you bringing data equity to your prevention work? Using gatekeepers to reach populations. Good. That's a good example. For example, in a tribal community, we may be talking to elders to gain access to talk to a tribe. And so identifying and building those relationships is crucial. Reminding colleagues that one size does not fit all, cannot simply use an existing questionnaire just because it exists. Very true. So we've got to make sure that the evidence-based interventions we're selecting, the tools we're selecting are all appropriate for the context. We need to ask questions that are culturally appropriate to the group you're working with. Yes. Frequent check-ins. Good. We are trying to learn how different communities in Wisconsin have been targeted by alcohol, advertising, and marketing, and then use local data to advise accordingly. Data to entice and encourage parents. Checking the wording of questions with the population. Good. So inviting experts from the communities to come in and have the wording of the questions piloted, reviewed, and then refining those. Good. All right, well, let's move on to our next question. How can prevention address power imbalances with data collection and use? How do you think prevention can address power imbalances with data collection and use? So Celia says, obtain participant experiences and ideas. Good. When we are working with communities, our communities are the experts. And so going to our communities and asking them what power imbalances exist in the community, what are ways that you can work with the community to address those during collection is really important. Marilyn says involve the community members. Good. Being as participatory as possible during the entire process. Yes. Engage and train participants to facilitate collection. Training is also super important. So making sure our folks that are engaging in data collection or analysis activities are properly trained and that we have built the capacity around addressing some of these power imbalances. All right. Well, thank you all again for the great participation. I'm going to go ahead and move on here. Acknowledging the power imbalance. I just saw that one come through. Yes, acknowledgement is definitely the first step. We definitely need to make sure we acknowledge that before we can move forward. So this really points to our why. And this says research here, but this can also pertain to evaluation. Often in prevention, we're not doing that strict level of research, but it does kind of point to our why for sure. So right or wrong, research can drive decisions. If we don't address the power dynamics in the creation of research, at best, we are driving decision-making from partial truths. At worst, we are generating inaccurate information that ultimately does more harm than good in our communities. This is why we must care about how research is created. And I think that last line is really what drives it home for me. I think about that as the 2 C's. We have to care and we need to focus on that creation, because if we don't start there and then we try to analyze the data later, but we didn't create it in the right way. I talk a lot about, I had a professor that used to say with data, it can be garbage in, garbage out, right? So if you collect your data in a bad way that doesn't involve stakeholders, that doesn't have community participation, that isn't broken down on the form in the right way so that we can really focus in on where our issues are happening, then we are going to get garbage out. Because no matter how great of an analyst you are, if you haven't collected that data in the right ethical manner involving communities, you are not going to have a community-driven presentation or report in the end. So just really keep that in mind when you're planning. Sometimes planning can get overwhelming, right? We feel like we're stuck in the planning phase for a long time sometimes, But it's really important that we do that crucial planning at the beginning with our communities so that we have a good product in the end. All right, so I love this framework, and a friend of mine, LaShonda Williamson Jennings, passed this my way, and I just felt like this needed to be added. So I think this gives us a really great framework to work from. And it's from a research article from Key, and it provides the perspective on community engagement across the research process and how you can involve different levels. So we start at the very left with no community involvement, and then all the way to the end where we have a community-driven and a community-led process. And, you know, in the middle, we have community informed, community consultation, community participation, community initiated, all the way up to our community driven and community led. And we also have community-based participatory research, which is becoming really popular. And this is where the communities are involved in almost every step of the way. It may not be community driven or community led, but they are participating in each step of the research process. And so it's a really great way to empower and to make sure that you have a lot of transparency in your evaluation or research process. So it takes into account, which is extremely important in our work, the history. It builds trust, it builds relationships, and creates a level of transparency as we move across this continuum. And these are all the contextual factors that become really important when we are working with complex social issues. And we all know that substance misuse prevention is a complex social issue. And so we have to take into account these contextual factors in each of our communities that we are working with when we are doing an assessment, when we are doing evaluation, when we are doing research. And these then lead to our equity indicators. So we're looking at power and control. We're looking at decision-making within the group, influence, ownership, responsibility, and resource sharing. So looking at all these equity indicators that help inform the context and eventually help us build a community participatory research process. So I think this is a really great way to look at it and see how can I get further down this continuum? What things can we do at our organization to work toward that? At the very least, making sure we have a community informed process. If we don't involve our community at all, again, we're not going to end up with a good product. And then in many communities, the relationship building is so important. So taking the time to build that is going to make your research reflect the context much more. Okay, so how do we pave this path toward a community-driven process? We need to determine an appropriate and feasible scope. And that is going to have to involve the community, because we as the researchers, we may know the science, we may know tools, we may know evidence out there, but what is actually going to be feasible for the community? And so that's where we really need a lot of participation. Will the extra effort required to accurately gather more nuanced data actually help you to answer your question? Make sure the categories and subcategories you use align with what you want to explain or understand. Next, we want to make sure people feel safe. So we need to acknowledge the difficult political climate in which people may feel unsafe to disclose information about their ethnic origins, immigration status, related topics. And this fear among certain groups about disclosing information may be related to a fear of accessing services as well. And so this can contribute to even greater disparities and worse health outcomes among these groups. We also need to consider historical context and intersectionality, which refers to the interaction of multiple identities. So, for example, it may not be enough to understand the experience of being a woman without further considering how womanhood is experienced by race, ethnicity, nativity, class, sexual orientation, or other identities. So we accomplish this in part by using culturally relevant methods and doing our background research, right? We need to make sure that we've done our own research before we bring these things to the table. And you really need to get a better sense of the community before you dive into your new research project. The worst thing you can do is show up and not have done your research before you meet with the community. So make sure you've done your homework as well. Use both qualitative and quantitative data and seek out information from multiple sources when you're trying to unpack complex social issues. So one source of data can rarely tell us enough about an individual's or group experience to make those major decisions we might need to make in substance misuse prevention. And this can include incorporating the perspectives of those who are directly affected by the issue, as they are the experts, remember, about their own circumstances and experiences. And then similarly, we want to involve community members in interpreting data. And so we need to determine how we can disaggregate the data, which means to kind of unpack it by getting input from people who are directly affected by the issue. We need to involve community members in interpreting the data, making meaning, and generating recommendations, which are all critical steps to getting that disaggregation right. So again, the emphasis is we need to involve our community. Reaching out. So a big piece of doing participatory research and community-led, community-driven is to make sure we are collecting data from individuals who reflect the population and employ those sampling methods to obtain an adequate number of individuals. So often we may get asked to do a research project that has to happen quickly, or an evaluation that has to happen quickly. We don't have the time necessarily to involve everyone that we need to involve. So we go to what we call the convenience sample, right? I've got the social media site. I've got all these people on my group. I'm going to send the survey link out to all our folks and we're going to call it good. But then you never go back to compare your demographics, the context, the groups that you've collected data from to your actual population in your community. And so that sample is not going to be representative of the people in your community because you use the convenience sample. Using multiple modalities, formats, and language to communicate with stakeholders during assessment, making sure you are translating your documents, and not just translating, but making sure you involve an expert to evaluate the translation and make sure it was done accurately. This is, one of those things like communicate well and communicate often, right? To get the data out to all the people that need to be involved. So communication is extremely important. Examine data as you go to identify any gaps in reach and brainstorm ways to engage populations where there are gaps. So again, this is back to our SPIF, right? We've done some assessment. We're looking at the data, but then we see gaps. And so we have to brainstorm ways to go back and then engage those populations where there are gaps. So, and last we have here, involve stakeholders in the design and at each step of the assessment to ensure appropriate methods and communication are used. So finding out ways that are going to work best to communicate with the community by involving the community from the start. All right. Okay, so disaggregation, and we're going to get into some ways to do this now. So when we disaggregate via data collection, the kind of data collected matters, and it can help unearth a problem masked by aggregate data, even data that's already broken down by basic racial categories. So we want to make sure, because when we're collecting our raw data, this is the base level of information that we're going to have to use later in our analysis. We want to make sure it's good and we involve all the right people. And then that information then turns into our analysis interpretation and becomes information that can be used to make better informed decisions about our behavioral health issues in our communities that are useful to the communities we serve. So, for example, we may have survey questions. How did we break those down in the survey so that we collected data that can be useful? Did we ask for just basic racial categories, or did we break those down? Did we ask for just sexual orientation, or did we also ask for gender identity? So those are the things that you have to work out with your community in advance to figure out how far do we want to break this data down? How's it going to be useful to do that? Is it going to be relevant to our question? And how is that going to affect us being able to advocate on behalf of our community later? So make sure those forms you develop, they seem like an arduous task, but they are really important to make sure that you are addressing everything and collecting all the information you need. And a really great resource I've got listed down here, why disaggregating data by race is important for racial equity. And the link is there as well. And you'll be getting all these materials too. So I really encourage you, there's some great resources here that I just can't totally dig into. And so I encourage you to explore all of those. So another important point is that not collecting demographic data is not equity. Sometimes we are afraid to collect data because we think people aren't going to fill out our survey. And that comes from not talking to your community and finding out if that's going to be an issue, right? So sometimes we make assumptions about what people are willing to fill out and what they're not. And so that's why we need to involve the community in that data collection process. So it's uncommon, and I'm not picking on anyone in particular here, but we'll pick on the medical community for right now. It's uncommon for medical institutions to go deeper and seek sexual orientation and gender identity data. And sometimes that's an assumption that people don't want to share that information. But in fact, in most surveys, they've found that people are willing to share that information. And the reason it's important is because that can dictate what medical screenings are done, what services are offered, those types of things. And so when we don't ask the right questions, we may be keeping people from obtaining adequate medical care and thereby increasing health disparities. So again, it goes back to, have we talked to the community? Have we made sure this is what they want? Or are we making assumptions? Funding is often tied to data and outcomes. So when we're looking at data and the way it's broken down, if we're not collecting it and analyzing it in a way that points out an issue, that could affect future funding and future outcomes associated with that. And so then we can't address the problem if we don't know it's there, or if it's not made apparent that it's there. Prevention and other health-related issues cannot be addressed if the evidence isn't available. We talked a little bit about that. Confidentiality and safety should be ensured. So if you are collecting, highly sensitive data, that doesn't mean you can't, but you need to make sure that you're being transparent about it, that there's proper confidentiality in place, and that your participants feel safe. Transparency of how the data will be used is also important. So letting folks know, hey, we're not going to share your individual level data. This is just going to be analyzed in aggregate by, race, gender, et cetera, and presented in a report. So letting folks know up front how you plan to use the data. And honestly, sometimes if folks know that it's being used to acquire further funding or for advocacy, they're willing to participate as well, because they may feel very strongly that there needs to be change. So being upfront about that and being transparent is really important. Okay, so data types. I'm sure for some of you, this may be a review, but we just wanted to make sure. Let me check my time here to make sure I'm on task. All right. So briefly, we'll just say that we've got qualitative data, we've got quantitative data. The way I think of that is quantitative data is the numbers, qualitative data provides our context and our words that help bring the data to life. And that's how I like to think of it. So I think the most important piece of this is that we use mixed methods, right? If we're really trying to do a good job involving our communities, involving groups, and advocating, we need to make sure we're using mixed methods. You might hear the term data triangulation sometimes. And that's when we're using both methods to really look at an issue. And that tends to provide the context as well as the quantitative data that funders may also need, but it does help provide the context when we bring in that qualitative data. So collecting data multiple ways. And again, we do this a lot in prevention. We have focus groups, we have key informant interviews, we use observation, surveys, we may look at our service records. What sometimes we don't do, which is really important, is comparing our assessment, so our population assessment, to who we're actually serving. So making sure that you analyze that and make sure there aren't any gaps, because you may need to do more outreach in that way. The other thing I want to talk about here that just briefly is when we're analyzing our qualitative data, we often have transcripts, that we're using when we're analyzing data. And you may see something like, patient nodded their head or participant nodded their head. That's a thin description. And what we want to move toward with participatory research is a thick description or analysis. So yes, the participant nodded their head, but what's the meaning behind that? Did that mean they agreed to what was being said? Did that mean they were just saying they were listening? Did that have some contextual meaning to the community? Do we need to talk to the community about what that means? So we're really trying to push the envelope here and move toward that community-driven process. And so involving the community in the analysis and even looking at transcription and interpretation of nonverbal behavior is extremely important, because a researcher may not be, and most likely isn't usually, from the community being evaluated or researched. And so it's important to involve community members in how that information is analyzed and how you attach meaning to that. So that's called a thick versus a thin description. So we're trying to aim for a thick description in our qualitative work. Okay, so when we're acquiring existing data, this is another important point I'll touch on briefly, but how is the data collected? What was the method? What was the format? What was the original intent of the data? Is the data anonymous? Were there permissions? And with an equity lens, we're also looking at, how is the data collected? Not just that, but who is it collected from and in what way? Were they involving the community? Because if you're using existing data, which a lot of times is, a cheaper way to go and more accessible, but you aren't as aware of what process took place to get that data. And so it's important to ask those questions. Analyzing data with an equity lens. So as human beings, we encode our values, our beliefs, and our biases into analytic tools. Believe it or not, we do, by determining what data is used and for what purpose. So I remember earlier we were talking about the data are the facts, and that is true, but people can still, we have to remember that these are human beings doing the research, right? And that data can still be manipulated in terms of how we use it, what data we choose to analyze from the data set. So all of those decision-making processes, if it's just left up to the researcher, can be very biased. And so involving the community in each step of determining what data you're going to look at, how are you going to look at it, what's going to be presented, what's going to be the most useful is really important, because each researcher or evaluator or community member comes with a different lens and bias. So the data that institutions choose to use reveal what variables and reporting mechanism are valued most. So very important to keep in mind. A researcher may be more comfortable with quantitative data. I'm more comfortable with quantitative data, but that doesn't mean that I should only use quantitative methods when I'm working with the community, right? So bringing in other expertise, bringing in community members to really drive that home is important. Questions to ask. So with process, we want to ask, am I being systematic? Can it be effectively communicated to our stakeholders? And then with outcomes, what impact is it having on the community? Does it affect the quality of a program or strategy? And all of these are done by reflecting on the bias, the root causes, and the power within the community. So I love this because I think it is really powerful to think about how we do our processes, how we communicate, how we look at outcomes, and the impacts really do reflect our biases, our root causes, and power. So analysis options for equity and justice. So we are used to seeing, raw numbers, frequencies, and frequencies are just, okay, this many people went to this training, let's say. But if we only look at data that way, we don't know what the proportion is, right? So when we're looking at communities and we really want to see, look at data through an equity lens, we need to look at comparisons through ratios. Rates are another great way to do that. So, 3 out of what number said this was a problem? Well, 3 out of 5 is a lot different than 3 out of 100, right? So just saying 3 is not going to be effective, especially when we're trying to break that down by what groups may be most affected by a certain statistic. All right, so let's look at disaggregating data, analysis, interpretation. This is just an example that by looking at this graph, if we just look at all youth, it looks like, well, may not have too bad of a problem, right? But then if we look at breaking this down by race, we see that, oh my gosh, well, Black youth are disproportionately getting detention. And then we then need to ask ourselves, well, why? And that's where our qualitative data comes in. But if we only looked at that top number of all youth, we wouldn't be able to see that there was some kind of issue going on. So that's an example of how the data is broken down can really impact what strategies we're going to use. Here's another example. So when we're communicating data through an equity lens, this is an infographic, which is a great quick way to show an issue at hand and also advocate. So looking at this graph, what equity principles are used in the infographic? And you can put that in the chat here. What equity principles do you see being used? I'm trying to see my chat here. Comparisons and ratios, disaggregated, comparisons, use of color, great. Very good. So yeah, we're disaggregating, we're showing rates. Notice to the right here, we see the total is 16.7 deaths per 100,000, but for Black women, it's 40.8. And for American Indian Alaska Native, it's 29.7. So you can see how breaking the data down points to an issue. Pregnancy-related mortality ratios, 3.2 times higher for Black women and 2.3 times higher for American Indian Alaska Native than for white women. And so both the colors that are used, the size of the fonts, the breakdown of the data, using rates can really drive home an issue, because proportionately, we may not have an issue if we just look at, let's say, a frequency or percentage, but when we look at the rate, we can see that comparison. So, all right. And telling your data story using principles of data equity and justice. So make sure you're addressing your stakeholder communication styles, your needs, characteristics and values within the community. And these are all important ways to do that through visuals, the narrative, and the data. So presenting data with an equity lens, we have a video here, and let me check my time to make sure we have enough time. We do, I think. Because I think this is a really important video that highlights a lot of crucial issues with data equity. So this video provides a quick overview of recommendations to help you understand how to present data through a more diverse, equitable, and inclusive lens. So right now, I am going to stop my share, and Catherine is going to bring up a video for you to watch, and then we'll have some discussion after.
Thanks, Nicole. Give me just a moment and I will be able to pull up. Are you all able to see?
I am.
All right. We are going to see if the audio will work. Give me just a second.
We live in a world that is increasingly defined by data.
How's the audio sound, everyone?
I can hear it.
All right. Let me look at the chat. See how we do. Fine, good, all good. All right. Let's watch.
Data. But how we portray this data impacts the meaning. How would you feel if you were one of the data points in this visualization? The colors, labels, icons, and words we use are critical elements of our data stories. We need to take a closer look to ensure that our data stories consider the context of the incredibly diverse world that we live in. To be fair, to be credible, we must have sensitivity for our subject matter and our audience. We must be intentional and empathetic, guided by the most fundamental principle of all, that data points represent real people. Picture this. Doing good data means doing no harm. As data storytellers in a data-driven world, we have a unique set of responsibilities. To ensure that our analyses are trustworthy, we need to hold data up to close scrutiny. We need to ask hard questions as we gather information and apply rigor in our analyses. The Do No Harm Guide from the Urban Institute addresses the responsibilities we all share in using data responsibly to further the cause of equity in our society. Let's take a deep dive into these 10 recommendations from the Do No Harm Guide and learn how to represent data through a more diverse, equitable, and inclusive lens. Number 1, critically examine your data. Before you begin your analyses, consider the context of your data. Equity awareness begins with gaining a holistic understanding of the story behind the data. Where do your data come from? Who is included and excluded from it? How was it collected? Why was it collected? And who benefits or who is harmed by these data? Number 2, use people-first language. If your data is about people, make it extremely clear who they are. Remember that data shown reflect the lives and experiences of real people, and lead with the person, not the characteristic. In visualizations, labels matter. You should strive to use people-first language. Consider people with disabilities instead of disabled people, or people in prison instead of inmate. Number 3, label people, not skin color. Language is living, breathing, and ever-changing. It's only logical that certain labels that may have been used in the past are no longer acceptable and may in fact be offensive. In your data analyses, the best approach is to use full labels such as Black people, not blacks. Number 4, labels and their hierarchy have meaning. Who is shown first in the table, graph, or visualization? Order conveys a hierarchy and can influence the way your audience interprets the data. To avoid perpetuating historical biases in the way your data is presented, consider alternative sorting techniques such as study focus, specific story or argument, or quantitative relationship. Alphabetical order or sample size works too. Number 5, consider missing groups. It's important to acknowledge who is and who is not included in our data and charts. For example, in the United States, many charts on race and ethnicity only show white people, Black people, and Hispanic or Latino people, but not other racial or ethnic groups. Charts sometimes only show data in these broader racial groupings, rather than at a more disaggregated level where nuances are more readily understood. Consider adding notes that explain why the data are not inclusive or representative. Number 6, use color with awareness and care. The way we use color can inadvertently reinforce stereotypes and perpetuate inaccurate depictions of individuals and groups. To use color with the best intent, check your choices. Avoid using colors associated with stereotypical gender labels, pink for women, blue for men, for example. Colors associated with skin tones or race should also be avoided, such as light to dark or incremental color palettes used to indicate different demographic groups. When used appropriately, color is a powerful aid in data visualization. Lacking awareness, we risk creating misperceptions and offending our audiences. Number 7, consider the impact of icons and shapes. Icons, by their very nature, are intended to convey broad meanings, but they can perpetuate harmful and offensive stereotypes if used carelessly. These elements must be chosen with care. It's essential that any and all stereotypical, discriminatory, and racist imagery is avoided. It's also important that images depict people as empowered and dignified. It's never acceptable to use imagery that depicts people as helpless victims. Number 8, reach out and connect with the people at the center of your research. To tell relevant and impactful data stories, data communicators need to be empathetic. Building relationships with people and communities that you're researching is fundamental, and maintaining these relationships is just as important. You should do research and analysis with communities, not on behalf of them. Buy-in from members of the community, policymakers, and other stakeholders helps research be more impactful, relevant, and embraced by a wider audience. Number 9, reflect lived experiences. Not everyone has the same life experience. Our individual characteristics such as ethnicity, gender, and neurodiversity, and age deeply impact the way our research takes shape and form. Consider what your work may be missing and seek out colleagues and communities to help identify them. Number 10, understand the needs of your audiences. The value of your data lies in how well it can be used, shared, and understood by your intended audiences. As a data communicator, you're responsible for ensuring that the content is clear, unambiguous, and useful to your readers. This requires due diligence across every aspect of your work, striving to ensure that word choices, terminology, and even the languages that you publish in are fully optimized for your audiences and mindful of their needs. As people who are experts in the field of data science and data communication, we're in a position to improve how people view and understand race, ethnicity, and other aspects of identity, and make positive contributions to every aspect of society and culture. From how policies are created to how products are designed and built. We must lead by example. We must do no harm in our data storytelling. Our point of view should be grounded in principles of equity and fairness. If you fail to do so, you will reinforce damaging stereotypes and mischaracterizations. Or worse, we contribute to the narratives that lead to deeper stigmas and cultural divides. To learn more from leading experts at the intersection of data and equity issues, and to download the complete Do No Harm guide from the Urban Institute, visit the Racial Equity Data Hub.
All right. Thank you, Catherine, for showing the video. I'm going to go ahead and pull my slides back up here. Well, I hope that helped you all as you think about data equity and social justice, and especially with how we tell stories. And so I encourage you to access that Do No Harm guide from the Urban Institute. It's an excellent resource. And also share this video with your partners who are working with data, just to reinforce a lot of these concepts. After watching the video, I think it's important to think about those icons we might use and think about the colors we use to represent people in icons. Little things that we may not think about as we're presenting data that can have a big impact and continue to stereotype and stigmatize groups of people. So I encourage you to share that and look at that resource and share it with your partners. I'm going to check the chat here. Yes, I've also heard from at least one person who prefers to call herself a disabled person rather than a person with disabilities. Yeah, so sometimes, and this is why it's good to talk to our community and ask their preferences, because even if we are following guidelines, just like in the video, someone may want to refer to themselves a different way. And so it's always good to ask someone their preferences. And that's why we need to have that good relationship built with our communities, because there may be contextual things and preferences that we need to learn about before we begin a large evaluation or study. All right. So let's hear from you all now. I'm going to check my time again. Doing okay. So we may have time for only 2 of these, but these are just some things we want to hear from you about after watching the video. So let's say you are given data with overall frequencies for poverty and substance use in your community and asked to implement a program with limited funding. So what would you do to improve data equity and justice given that situation? We'll open up the chat here. Take a few suggestions. We may not have time for everybody to respond. So you are given data with overall frequencies. And again, those are just the straight numbers. This many people said this. So this many people are using, let's say, alcohol in your community. And you're given their poverty numbers as well. And then you're asked to implement a program with limited funding. What would you do? Check the chat here. Does the data show what that my community needs it? Did they ask my community if they want it? Good. Ask to engage recovery coaches, peer support folks in the project. Could you ask for the raw data and make adjustments? Ask the community, volunteers. Is the data broken down to ethnicity or age groups? Good. First, find out who did the study, who was included in the data collection. These are all great questions to ask. So and I love what you all did. You went back and said, you know what, I have more questions about this. That's my first step. I have some more questions about how this data came about. Was it even requested? What does the community say about it? Is the data broken down by subcategories? What do we know about this? Because this isn't telling us enough. So great. I appreciate that. You all are right on. So let's take another one. You are handed a bar chart, which is a graph. For those of you who may not know, it just has the bars with typically frequencies or percentages based on group or category. You are handed a bar chart displaying prescription drug overdoses by race, ethnicity that has all people of color listed last in a graph. What would you do? What would you do to improve data equity and justice? So check the chat here. You would do the opposite, okay? So reverse. Good. Any other ideas? Identify specific races, organize by alphabetical order. Who are the people of color? Break this down more, alphabetize. Good, good. So those are all great answers. So you would look at different ways that you could display that data. Because again, we don't want to stigmatize, we don't want to discriminate, and even the way we display data in a graph can be discriminatory. And so I typically will alphabetize race, ethnicity categories. Sometimes if I'm trying to make an impact with who's most affected by something, I will use the actual quantity of those responded and use that as the order. So it just depends. And again, you need to go back to your community even and say, what's the most appropriate way for me to display this data? What makes most sense to you and doesn't do any harm? So taking that data back, taking that bar chart and saying, what do you think about this? Good. All right, and I think we have time for just one more. So you are presenting on data equity, and a participant says there is no diversity in their community. And this has actually happened to me. So you are presenting on data equity and a participant says there's no diversity in their community. What would you do? What would you do? Okay, so Susie says diversity includes more than just skin color. Absolutely, absolutely. What? How do you know that? Ask. Right, right. So, and sometimes we get these questions, right? I don't know why we're collecting this information. I don't live in a diverse community. Colleen says, ask the group to come up with a collective definition of diversity. Good, good. So go back to the community again. Awesome. So yeah, I think, it's a teachable moment, right? So maybe you go back and say, like, what do you mean when you say there's no diversity? Have you thought about this group, this group, this group? What's your data saying? Are you collecting that data, right? Have you even collected information that goes to a deeper level? So those are all great points to make. Fabulous job, everybody. All right, well, in the interest of time, we're going to skip the last one and move forward, but I appreciate all the participation in those activities. And these were actually all scenarios that I've had in my experience happen. So these are real things that happen, and just, make sure you're going back to the community, make sure you're involving the people that the data is about. All right, so our call to action, right? We are preventionists. So what does this mean for us? By focusing on data equity and justice, we are acknowledging the history, the harm, and the potentially negative implications of data integration for groups marginalized by inequitable systems. And so this is a key first step. We just need to acknowledge that. But then that's just the first step, right? So the next part of the quote is we have to go beyond this. We must center the voices, stories, expertise, and knowledge of these communities in decision-making and take collective action with shared power to improve outcomes and harness data for the social good. And this is a quote by the Actionable Intelligence for Social Policy. So just going back to part of our ethics, right? We're going back to recircling back to those ethics principles we talked about at the beginning, which does involve advocacy. And so if we're not taking action on some of these issues with data equity and social justice, then we're not doing our jobs. So as a preventionist, make sure you continue to advocate for data equity and justice within your organizations and beyond. So wrapping up, we just want to take some action here, right? So in the chat, just describe what is one way you will take this information, take it back to your organization, and you will incorporate data equity and justice into your prevention work. What is one way you will incorporate what you've learned today and take it back? And so we'll open up the chat. What is one thing? Okay, good. Kathleen says, ask more questions about the data we use. Yeah, that's a good first step. Involve more people in the data collection. Sharing with the coalition some of the really actionable strategies. Good. Colleen says, relook at how we display data. Yeah. Consider missing groups. Include our stakeholders in interpretation. Advocate the survey questions to be developed that represent my entire county. Don't just use something that is already developed. Good. Seek diverse perspectives in data analysis. And Lisa says, consider different ways to display the data. And Katrina says, involve or include more methods and people in the community up front, then ensure the reporting is reflecting of that. Ensure equal representation and involve stakeholders in designing surveys. I see some advocacy, good. Teach about data equity and justice, right? That's often a first step is many people may not even be aware of these concepts. So we need to make sure we're educating. Reach out to the PTA about a parenting class that is being considered. Good. All right.
So, Nicole, we do have a few minutes and a few questions.
Sure.
So our first one pertaining to the reaching out slide with applying to evaluation versus research.
Mm-hmm.
It can be hard enough to get enough. It can be hard to get enough participants and then be able to apply those steps. So what can be done to sort of work within that?
Yeah, so we do we do have to think about what's practical also. And I think just acknowledging often to the community, again, I would say first step is going back to the community and saying, like, look, these are the best practices that we know about. We may not be able to do all these. Do you all have advice for how we might do this better or do this in a more feasible way? And so that would be my recommendation in that instance, is to go back to the community and just ask. We have this given time frame, we have this limited of resources. What's the most important thing to you to have done to involve the community in this process? So I would go back to the community.
And then perhaps a bit related, how do you handle population size? With CDC data, if the population of a county is too small, the numbers are often hidden because that could give away identity.
Mhm.
But then those comparisons and using that data is less accurate. So how do you balance that?
Yeah, that's a really good question. So often with federal data sets, due to protection, due to small numbers, we may not be able to completely show that data. In that instance, so you may be looking at, like, let's say a small county. It depends on the geographic area. What you could do is then look at a larger geographic area that incorporates your area to see if that N increases enough so that you can at least use that data to show what's happening with particular populations. So that's one way to do it. So you can increase the geographic area that encompasses yours and make some implications from that. However, I would also follow that up with going and doing using qualitative research methods to investigate the issue further. So given the data you've gotten from a larger geographic area, how is that actually happening in my community with this particular population? What's the context? So don't forget the context piece. You can also take the data from a larger geographic area and then ask the community what they think about that. And that's usually a good starting point. Is this what you see happening? Does this kind of get at what you're seeing in the community? What other things may be impacting this that are part of the context? How might we get more information about that?
And then the last question we got, what if the community does have significant diversity, but the public health practitioners and other people using the data don't represent that diversity for whatever reason? What's a good way to remedy that?
So that's a little more complex, but I do think you can start out small, right? So awareness is the first step in the process. So maybe going to the administrator or prevention coordinator, if this is a prevention system, and saying, you know what, we need to really build a diverse workforce and reflect the population that we're serving. What are some ways that we can work together to do that? I also think just advocating for policy, change, your interviewing processes, hiring practices, those kind of things. Working with HR, if you're in a bigger entity, can be helpful. They may have practices that they can share that would help you build a diverse workforce. So that's not my area of expertise, but that's probably where I would start is just to reach out to administration, HR, to brainstorm ways to remedy that.
Well, we are actually a little bit over time.
Okay.
Thank you so much, Nicole, for presenting this fantastic webinar. Tons of great information.
Thank you.
I am going to put our GIPRA survey link here in the chat for everyone. If you could take a moment and fill that out. It will also be arriving in your inbox tomorrow with the follow-up email. Additionally, I know a couple of people have asked for slides and other presentation materials. And I am also following that up with our box link. And this will, again, also be in that follow-up email you get tomorrow. Additionally, in that follow-up email, there will be a link to the Learning Lab, as well as a link to the website where you can receive your certificate of attendance if that's something you need. And we hope to see you all at other PTTC webinars and events. Thank you all so much for attending, and you all have a great rest of your day.
Thank you all so much. I appreciate it.